I'm Maninder Kalkat. I'm a consultant thoracic surgeon for past 6 to 7 years, and I work for BMI Healthcare. As the name suggests, it is the cancer which affects the lungs, and this is the cancer which is the most common cancer, and second after the breast cancer. The incidence is rising, and little less than quarter, about 22 to 23% of deaths because of cancer is because of lung cancer. The commonest cause for lung cancer is smoking. The people who've been smoking are at very high risk of developing lung cancer. But then there are people who have worked in industries like exposed to asbestos or radon can also get lung cancer. And there are people who may not have any of these predisposing factors but has genetic predisposition, and they can get lung cancer. And then there are a few people who have relationship with diet or some other reasons which are not yet known can also get lung cancer. But smoking still remains the commonest cause for lung cancer. If people were to stop smoking, definitely there will be significant reduction in the incidence of lung cancer. The people who smoke are at very high risk of getting lung cancer. And in fact, with the people knowing the risk of developing lung cancer and with all the campaign going around asking people not to smoke and restriction on smoking in public places, the incidence of lung cancer will start coming down, and there is indications to that effect. The commonest symptom of lung cancer is cough. Almost about 2/3 of the people with lung cancer will have cough. So anybody who has a cough which is not going away should be investigated. Anybody who has got a blood in the phlegm or when they cough has to be investigated. Then there are some people who get chest discomforts like shoulder pains, and any unexplained pain which is persisting needs to be investigated. The people with lung cancer, especially who have advanced lung cancer, may complain of loss of appetite and loss of weight, and these needs to be investigated. Like any cancer, if it has to be treated, it has to be diagnosed early. Unfortunately, the lung cancer still gets diagnosed very late. Not more than 15 to 20% of lung cancers are actually resectable. By resectable, I mean that we can remove it surgically by the time they present to us, because they are far too advanced to be treated with the intent of cure. So it is important that we diagnose them early. We diagnose them at an early stage. If we diagnose them at early stage, the chances that the patient will be cured is very, very high. So one should be mindful of these symptoms like cough, hemoptysis, that is blood in the sputum, or chest discomfort, and report to the doctor and get it investigated. The most important thing people can do is to quit smoking. This is the most important one preventive factor which, if people follow, will reduce the incidence of lung cancer significantly. The people who are smoking should give up smoking today. There is a lot of help available. The best is go to their GPs. They can be directed to various smoking cessation programs. There is help available to help them to quit smoking, and they should avail that. This is one important message which needs to go across to everyone, that do not smoke. It only harms you. Not only does it cause lung cancer, but it causes many other diseases, most importantly various cerebrovascular diseases.